buenos días para todos y todas. Estamos
Good morning, everybody. We are starting with the last journey, the last session of this regional platform for disaster risk reduction for Latin America and the Caribbean. According to the data we have 990 people here. They are enjoying Punta del Este, and 1,900 who are connected remotely. And we would like to welcome you from the Hopi platform. I would like to reiterate the invitation to use the hashtag PR23 and the SINAE networks in Facebook, Twitter, and LinkedIn so as to see the photo coverage. Apart from this, Laura, we have to make an announcement. You're going to be receiving until 10 o'clock in the morning an email that will be available so as to answer this survey about this 3-day event. This survey will be available right now, and you will be receiving that survey. So we're going to start with the plenary session number 4, which is called Recover and Build Back Better in a Context of Increased Uncertainty and Complexity of Risks, Experiences and Lessons Learned. The session is organized by the United Nations Development Program, the Caribbean Disaster Emergency Management Agency, the Pan American Health Organization, the Coordination Center for Disaster Prevention in Central America and the Dominican Republic, and the United Nations Major Group for Children and Youth. Carolina Portalupi will moderate this session. She's a consultant with expertise in risk management and recovery, and she focuses on governance, public policies, and post-disaster recovery. She also coordinated the disaster response in the Ecuadorian coast, and she has been part of the Constitution of the Republic. As UNDP consultant, she has worked in Ecuador and Peru in the recovery post-earthquake in Mexico in 2017 and as technical assistant for the presidency of the Republic. She now provides technical assistance for the Agency of Risk Management. Hello, Carolina. Good morning, everybody. We would like to give you a warm welcome to this 4th plenary session of the 8th Platform for Disaster Risk Reduction, which has been sponsored by the government of Uruguay and fostered by the Office of the United Nations for Disaster Risk Reduction. The topic today is to recover and build back better in a context of increased uncertainty and complexity of risk. We have 3 objectives for today's session, and it is to talk about the opportunities and challenges of recovery post-disaster in context of great uncertainty and complexity, and to identify the opportunities for a resilient and inclusive recovery, and to talk about how science and technology can be better integrated for good recovery processes. We have with us here, I'm going to introduce Monica Shox-Pana. She's medical anthropologist, senior research fellow at the Johns Hopkins Center of the Bloomberg School of Public Health. We also have Cynthia Spica. She is Associate Administrator of the U.S. Office of Policy Program and Analysis. We also have Elizabeth Riley, Maria Lisa Haile, and Daniel Salinas, Ministry of Health of Uruguay. So we would like to give you a warm welcome. Which will be the modality here? We will have 3 dialogues. First, the panelists will have up to 8 minutes. The second session, the panelists will have up to 5 minutes. And the third session, where they will have up to 2 minutes to answer some of the main questions that are part of this dialogue. Once this first part finishes, we will ask Daniel Salinas, Minister of Health of Uruguay, to make a presentation on how in this host country they integrated science and technology during the COVID era. So we're going to move forward with our first question for Monica. And Monica, we would like to know, taking into consideration the lessons learned by the recent pandemic, which do you think are the challenges and opportunities to improve recovery facing disasters associated to multi-hazards and complex environments? Thank you, Carolina. And good morning, dear panelists. And that's the end of my Spanish today.
I see 3 major opportunities and challenges for improving recovery in the context of greater and greater risk and complexity. First of all, because of the pandemic, we're at an inflection point in the relationship between epidemic risk management and disaster risk management. And further integrating these worlds can advance our ability to confront future complex threats. And let me touch on that. Public health emergency management can really learn from disaster risk reduction, which has a much more mature approach to recovery. It's multi-sectoral and it's focused on the needs of the whole person. And until very recently, i.e., the pandemic, public health emergency management really has had more of a response mindset. You can just look to the international health regulations, which is the governing framework for global health security, to see that they scarcely mention recovery. Also, public health emergency management has historically held, and even till today, a medicalized view of recovery. They see as key indicators of the resolution of an epidemic vaccination rates and morbidity and mortality rates. But just because an epidemiological curve drops off, it does not mean that the work of fully healing society and local communities is done. At the same time, I really do think that experts in epidemic management can bring fresh eyes to the work of people who worry more about climatological and geological hazards. For instance, not all society-stopping catastrophes involve the destruction of buildings. The pandemic knocked down the human immune system, and especially before safe and effective vaccines became available. And even now, we still have the problem of a mutating virus. Secondly, there is, again, the underscoring of the need to strengthen health sector resilience. During the pandemic, hospitals were simultaneously vulnerable. That is, they had health workers becoming sick and they faced disrupted supply chains, but they were also essential to reducing pandemic-related losses. And we can all remember overflowing emergency rooms and intensive care units. So we need unification of epidemic and disaster risk managers. Secondly, the pandemic has demonstrated that disaster risk management and public health emergency management face a common and persistent dilemma. And it's got a new element to it. And that's the understandable human impulse to return to the so-called normal even if it reproduces the very same risk, especially for the most vulnerable. Now, we know in the wake of any disaster, multiple futures are possible. And on that spectrum, at one end is transforming society to be more risk resilient. But on the other end is reproducing the status quo. In the case of the United States, which I know the best, there have been over 1.1 million COVID-related deaths, and each day, hundreds more are added. Despite this reality, many in the country assert that it's time to move on. However, the human stakes of moving on are very high. In my country, Hispanic, Native American, African American, and lower income communities have experienced disproportionate rates of infection, hospitalization, and deaths, as well as greater insecurity around housing, food, and finances. And this is in comparison to wider and wealthier communities. So for these vulnerable groups, returning to normal simply means retreating to the same life circumstances that created their enhanced vulnerability to the pandemic's social, economic, and health impacts. So, in comparison, building back better would include undertaking systemic reform like fixing racial disparities in access to healthcare and expanding economic opportunities. And these are major changes that may face political and/or social resistance. And then lastly, there is the need to heal the internal wounds from multiple complex disasters. The pandemic's uncertainty and totalizing effects over a very prolonged period, plus for some people, concurrent disasters. This has thoroughly exhausted many people and even eroded their hopefulness. So for families and communities grieving loved ones lost to COVID, coming to terms with the individual and collective deaths is a struggle. Trauma recovery at the population level will require interventions at scale to promote safety, social connection, and memorialization. Burnout among health professionals reached unprecedented highs during the pandemic, and doctors, nurses, and public health practitioners are still walking away in some cases from their jobs. So in that case, recovery is going to have to involve strengthening workforce resilience and refilling the professional pipeline. Now, the trauma that communities have experienced is not just limited to COVID-related losses. There's also, particularly in the United States, political division, social fragmentation, and the existence of strong social justice movements. So a genuine equity-driven recovery would be one that incorporates affected communities and the data, analytics, and institutional processes for achieving societal repair. So unified disaster and epidemic managers, let's overcome pandemic fatigue and the associated resistance to building back better. And we have to adequately address population level trauma. Thank you very much. Muchas gracias.
Gracias, Mónica.
Thank you, Monica. I think that we are faced with some challenges. First, this turning point, as Monica mentioned, with regard to pandemic management and an integrated disaster management, and also the challenges and the tensions between going back to normal or taking advantage of the opportunity to transform. I would like now to ask Cynthia to consider how, amidst the climate crisis, how FEMA approaches recovery and support to U.S. community in an evolving risk environment. Cynthia, the floor is yours.
Good morning. Gracias, Marina, and it's nice to be here with my fellow panelists. Thank you for the question. I think there's 3 focus areas I would want to highlight in terms of how FEMA thinks about recovery and how we can support communities. And some of them will intersect a lot with some of the comments that Monica already started with. So the first one I would start with is thinking about equity. And we talk about it in the context of not just a separate piece of how we deliver our programs, but how it needs to really be integrated across both the development as well as the delivery of these programs. And then finally, the evaluation. FEMA recently released its new strategic plan, and equity and instilling equity across everything we do is our first goal. So that's been one thing that we've been especially focused on in terms of how we're thinking about supporting these communities through recovery. There's a couple of tactical ways that we've been thinking about this. The first, and one of our Canadian colleagues mentioned this on a panel on Tuesday, is where possible, we want to be developing those relationships with communities pre-disaster. It becomes more difficult to deliver these programs long-term when we are creating those relationships on an ad hoc basis. The second thing is developing tailored recovery plans with the communities. And these need to be focused on what their specific outcomes are and what their specific needs are. They're unique to every community. We can't come in kind of with a standard template for what these are going to look like. We need to work directly with each of these communities on that. And I'm going to talk about workforce in a little bit. And I know Monica touched on that also. And many of you, this may resonate with, but sometimes the groups that we're working with on developing these recovery plans are a small team. Sometimes it's one person. Sometimes it's one person with 6 other jobs. And so thinking about how we can best support them through that is a couple of things that we've done is by offering technical assistance, by embedding team members with those teams or individuals so that we can support them through the process and provide that advice as they're working through the planning. And then lastly, we want to be removing barriers to access. We've heard a lot of examples about this in some other panels this week, but we have to make sure that the way that we're delivering these programs and the way that we are talking about them is done in an accessible and culturally competent way. And one of the things that we've also found especially useful is utilizing trusted messengers within the communities rather than the message just coming from other individuals from externally to make sure that the communication is resonating and that it's information that's again, kind of competent to the particular community. And again, I would just reinforce that recovery works best when the community identifies what its specific outcomes are and what success looks like for them. The second thing I'd talk about is our focus area is really climate resilience and the need to acknowledge future disaster environmental changes and what that's going to look like for each unique community. The topic of this platform is science and technology, and I think that this is where one of the big areas we can bring that into long-term recovery and thinking through ways that we can really incorporate what we know about not just today's risk, not just historical risk, but also what the future risk can look like. There's some long-standing things that we've used like flood mapping, but there's also a lot of new technology and science and analytics that we've been bringing into these conversations, such as the National Risk Index, which takes a look at the way that several different natural hazards will be impacting communities with contributions from over 71 different federal entities, private sector, academia, to provide information to inform what some of that long-term recovery planning could look like. To give an example, we've talked a lot about specific disasters that each of the member states have been facing, but I want to give one that really resonated with us in terms of being more creative with recovery, as well as how we had to bring in some of our client resilience work. In December of 2021, one of our states experienced one of the worst fires in their history. And while it's relatively small in scale from some of the fires that I know several of you have been dealing with, it did destroy over 1,000 homes in less than 24 hours. It was a wind-driven grass fire that really just, again, 24 hours rapidly created a lot of challenges for the community. And many of you know that fire debris can create a particularly significant health threat. And so that was one of the things that the community had identified as one of its priorities. And so one of the things that FEMA does is in addition to also delivering on our particular authorities and providing our resources, is we're responsible for convening the many other departments and agencies that contribute to recovery. And so one of the things that we did was work with them to mobilize for technical assistance to be able to dramatically accelerate the removal of several of the debris in less than 4 months. And then we are also able to reduce some of the waste in preventing just under 3 million pounds of carbon dioxide being released into the environment. So just thinking of different creative ways that we can both prioritize what the community's outcomes and what success looks like for them, but also thinking about doing it in ways that are really resilient and building up and being supportive of that climate consideration. And the last thing that I would say is talking about workforce. So emergency managers and disaster risk reduction practitioners are really at the forefront of the climate crisis. And Monica talked a little bit about how some of those significant impacts during COVID are continuing to stress our systems with the healthcare workers. And I think that the expectations of our professions as well as our organizations are only increasing. And it doesn't seem like there's disaster seasons anymore. We've talked to a couple other folks about that this week, where we would typically see kind of like a rest and reset cycle. We don't really see that anymore. Reflecting on COVID, I know that there's most often we will see our kind of rest reset cycle in the winter, springtime, but that's also where we saw our surges for COVID. To give kind of an acute example, we have a National Response Coordination Center at FEMA where we bring in all of the interagency. We do situational awareness, we do resource adjudication and sequencing. And the previous length of that, or the previous longest term that had ever been activated was 79 days. And that was one of our most significant hurricane seasons. And during COVID, we were activated for 500 days, over 500 days, I should say, straight, which is a pretty significant stressor on a consistent drumbeat of working through the response and the recovery and really bringing together all the folks that are focused on this significant issue, but is also very unsustainable in terms of taking care of our workforce. So we want to be thinking about ways that we can really rethink readiness and planning and support our workforce, both with training and development, but also creating capacity across all levels of government and with the communities. We've been on a campaign to build this and talking about it with all of our partners and thinking through new and creative ways that we have those opportunities so that we've got a resilient and supported workforce so that we can be effective partners in recovery. So those are the 3 areas I would highlight that FEMA is focusing on.
Gracias, Cynthia.
Thank you, Cynthia. The key role of communities in the post-disaster recovery processes and the importance of paying attention on equity issues, including climate resilient aspects and workforce preparedness of all the stakeholders that are involved in the recovery processes. Now, we would like Elizabeth to share CIDIMA's experience. Which do you consider are the necessary conditions to ensure that post-disaster recovery be integrated in a more effective manner in the integrated disaster risk management at a country level and also at a regional level? Elizabeth, the floor is yours.
Thank you very much, Carolina. And good morning to everybody. It's really great to be here and to join this very distinguished panel, and I really enjoyed the interventions by the 2 prior speakers. So it's no secret that the Caribbean is one of the most vulnerable regions of the world when it comes to hazards, and we face a diversity of hazards. And because we're at the forefront of the climate crisis, this adds another level of complexity when we're discussing all aspects of the disaster management cycle, including recovery. So the work that we're doing in the Caribbean on recovery is very much evidence-based, and we apply what is called a comprehensive disaster management audit every 3 years or so in our states. And repeatedly, we have seen that countries have scored lowest in the area of recovery. And this has been the genesis and the foundation for the work that we've done. So at the strategic level, it's important to note that we have very strong support at the political level through the Caribbean community. And CARICOM has identified building a resilient Caribbean as a strategic imperative, given the vulnerabilities and impacts suffered by the states over the decades. In fact, in 2018, CARICOM declared a vision of the Caribbean being the first climate resilient region in the world. It's a very ambitious aspiration, consistent with the goals of our regional strategy on comprehensive disaster management. So the focus on recovery was adopted by the heads of government in July 2018 as a pillar of what we refer to as the Caribbean Resilience Framework. And as a strategic response to this recognized need, the Caribbean Resilient Recovery Facility is established as a regionally owned and driven mechanism for the coordination of ex-ante and ex-post resilient recovery services to our participating state. So in essence, the Caribbean Resilient Recovery Facility is a governance mechanism, and it is geared towards strengthening ex-ante and ex-post recovery, supporting building back better, fostering planning for more resilient growth and development in the region. The facility will enable a streamlined offering of recovery services and provide strategic and operational guidance for our recovery efforts in respect of economic growth and development drivers, as well as for affected populations at the regional, national, and the community levels. So we know, of course, that recovery is multi-sectoral, and it requires the support from a wide range of actors, including the public, private sector, civil society, as well as our community and international partners, and for them to work in close collaboration for effectiveness. Therefore, local governments in the small island developing states, such as CEDIMA states, may need a great deal of support to manage recovery immediately in the aftermath of disasters. So to assist the states with respect to recovery, we are also advancing the operationalization of this facility with the launch of a consultancy which will design the details of this mechanism among key regional agencies and partners, along with a detailed program of work. And we officially launched the facility in December of 2021. It is actually led by the Caribbean Community Secretariat, and CEDIMA plays a coordinating role. And we have strong partnerships with a range of regional and international agencies which already have strong capacities in the area of recovery. So specifically, we have 4 objectives for the facility: to build national recovery capacities before a disaster takes place, and CEDIMA is leading on this component; to bridge the gap between response and early recovery, that transition period, which tends to be a bit challenging; to enable fast-track recovery in the aftermath of disasters. In other words, how do we shorten that time frame for the actual recovery to take place? And fourth, to build resilience of the region by ensuring disaster risk-informed recovery efforts and investment based on the principles of Build Back Better and fostering inclusion. In other words, this is looking at the longer-term recovery horizon. So in terms of the vision of when the recovery is fully operationalized, we will also support the identification of experts who will help in recovery through the development of a roster of experts to be drawn upon ex post for technical assistance and surge support. And this is an important feature for small island states where we have limited human technical skills in individual states. But if we look at the requirements from a collective perspective, the horizontal cooperation arrangements are really critical to making sure that we can achieve the objectives that we want to under the recovery. So let me touch a little bit on the Model National Recovery Framework, because to operationalize all of this at the national level, we need to have tools and guidance. And this is the function of the National Recovery Framework. And we developed this in collaboration with an adaptation guide. And it's a strategic document that offers guidance on developing a planning framework for both national governments as well as at the community level. And we updated this framework in 2021 to be more gender responsive and to provide guidance on institutional arrangements for recovery, including key actors and the specific tasks that they should execute. And the recovery framework aims to support governments at the national level to assist with recovery planning as well as implementation. And it presents key steps and considerations at a broad level, and countries will tailor the recommendations and institutional arrangements to suit their specific context. So it's not prescriptive. It gives guidance, but it's also flexible and can take into account national level realities. And those institutional arrangements that we speak to include the organizational structures, the policies and procedures that countries will need to put in place to plan, manage, and implement disaster recovery operations. The development of the national recovery frameworks, of course, is a proactive process. It requires anticipating future recovery issues and building capacity to improve recovery outcomes all before the actual event happens. And by developing the disaster recovery frameworks, states are better positioned to drive a process forward that unites all government, private sector donors, development partners, and community efforts with a focus on building back stronger, faster, and more inclusively over the short, medium, and long term. And I think I'll conclude there and happy to discuss it further as we continue.
Gracias, Elizabeth. Interesante.
Thank you, Elizabeth. It is interesting how CITIMA has been supporting the countries of the Caribbean region in order to strengthen their capacities for this post-disaster recovery and the development of the national framework for recovery as a planning framework for recovery and to improve governance. And on the other hand, the importance of these Resilient Recovery Fund, which addresses one of the main challenges of recovery, which has to do with funding. I would like to ask Maria Luisa Hayem, the Ministry of Economy of El Salvador, to share with us the main actions that the government, the administration of El Salvador, did in order to address the multi-hazard issues and the challenges of resilient recovery within this context. Thank you. Thank you, Carolina. Good morning to all those present here, but also those people who are connected remotely, especially from El Salvador, where it is very early. But it's an honor to be here and to represent the government of Nayib Bukele. We have been governing for 3 years and a half, and as Carolina has mentioned, it has been, we have had several crises that followed us during these few years, but we could overcome each of them. And not only that, today El Salvador is living its safest moment in the communities. El Salvador has the most positive economic behavior in our history. So El Salvador was the country that grew the less, and it was the most unsafe in the world. And now it is a country that has been transformed during a short period after some crisis I'm going to share with you this morning, but always with this satisfaction that we achieved, we could overcome them. I would have liked to share with you the work that we have done in order to transform our country in such a short time, but we don't have much time to share. But I would like to focus on where we are in terms of the economic matter, and what is it that we did in order to address the different crises, and which were the 4 elements that were common during the different crises, and how the government addressed the different crises that we believe is important to take into account in the future. But going back to the economic area, El Salvador was thought to recover from the COVID-19 crisis probably this year. Some doom forecasts assured that it was in 2024, but in 2021 we have already recovered all the employment that had been suspended during the pandemic, and now we have 170% more employment or employment rate than those jobs that were lost during the pandemic. And El Salvador had a growth of 10%, which was a historic growth rate. If we analyze imports, exports, investment, employment, we are at our highest capacity of what we have ever experienced in history. And why is it that we are here? And why do I refer to this positive growth? And this is how El Salvador dealt with the COVID-19 crisis and how we addressed other crises such as inflationary crisis that is still present in most of the countries in the world. But COVID came a few months after this administration started. El Salvador had 45 UCI units, and we had hospitals that were not enough to satisfy the needs that had been created with this crisis. And with the leadership of Nayib Bukele, a hospital was built that passed from 45 intensive care units to 1,000 intensive care units, rooms in 3 months. And we could also provide the population with the medicines and the food they needed, and we saved the life of thousands of people in the country. Vaccination was also a successful process. We were one of the few countries in the world that had really high coverage and with different doses. Those were some of the areas we worked on during the crisis, but we also worked in the economic arena. And this is very important in order to address the crisis and the challenges of our countries. That is how we evolved somehow. We also suffered Amanda Cristobal storms, and we had the UNDP support so as to carry out our impact assessment for the impact that not only the COVID has got, but also these storms. Together with several institutions, we carried out this impact assessment that allowed us to identify which were those areas where we had to focus in order to overcome the situation, the inflationary crisis. It was the same approach. It wasn't mentioned before. It includes the use of technology, a different way of addressing the challenges of development. And together with other 10 institutions in the government, we overcame this inflationary crisis, and this allowed to maintain one of the lowest inflation rates in Latin America, the fourth lowest rate, with inspections so as to make sure that those programs were actually reaching our population. In conclusion, I would like to let you know which were those elements that we thought that allowed us to be where we are today. And one of them is the comprehensive approach. I have already spoken about COVID-19 and how we address the health aspect, but we also worked on economic projects, and we gave a bonus to our population so as to live through those difficult moments of the pandemic, but we also developed a program with $600 million in order to give funding to the companies that were facing very hard time during the pandemic. So this is a way to move forward. This is our approach to address those challenges which have maintained in difficult situations during so long. The intersectorial work, having at the table during the COVID, we worked with the business sector, with the Ministry of Tourism, Ministry of Economy, all together in order to overcome this crisis. The leverage in technology has also been crucial in all the projects we have implemented, both in times of crisis, but also at large. That is how we believe we're going to finally move on. And the use of sufficient and adequate resources. At times of crisis, we cannot think that we are going to move on, but it's worth to invest the funds that are necessary, because if the difficult times we have overcome with an inflationary crisis and the COVID-19 crisis, if we hadn't invested all the money which was invested by the government, I couldn't be here today with this smile telling how El Salvador maintains its employment, high employment rate and its economic development rate. Because when the life of our population is at stake, there is no other option, and that is why we are ready today, and we will continue with these trends and this to growth and with the sound basis for the future. Thank you, Maria Luisa. We're going to start with the second session. And as the experience of El Salvador is interesting, and I think that we can have more time in order to dip further into that experience, because it has to do with the possibility that the recovery processes, when they are carried out, and these processes have a sound basis in the technical and political aspects, they contribute not only to macroeconomic stability of our countries, but also to face some of the main challenges of the human impacts that these disasters have, especially for our communities. Therefore, we are start the second session, and I would like to start with Maria Luisa so that she can have further 5 minutes, up to 5 minutes, so as to talk about those decisions that were made when addressing recovery in the face of COVID and other events, and how this has become an opportunity for human development of El Salvador. Thank you, Carolina. And I think that there were several lessons learned during these times of crisis, and I also shared this with the business sector during the crisis is when many opportunities arise. And I have already said these, but one of the opportunities was to be able to work with the business sector, to work together on a plan for the economic openness, with the risk that it represented to the population to go to work. Well, we did an openness plan that involves the business sector as well, and to have established that dialogue tables together with several government institutions makes us to have that infrastructure already established and having a constant dialogue with our sectors. But also, during the pandemic, some of our productive sectors were even strengthened. Our textile sector, which is one of the strongest one, could transform rapidly, and it came to be one of the first countries that sold products to the US to address the pandemic. So there was a clear opportunity there. And those opportunities were present for El Salvador. The sector, which has a great demand up to date due to the crisis of COVID-19, but that harsh context allowed us to carry out that impact, post-disaster impact, together with UNDP, that allowed us to see which were the impacts that have come out of these crises that we have lived through, but also to have a recovery framework and actions, concrete actions of what was needed for a reconstruction and a solid and sound reconstruction. Something that was also an opportunity within this context is that other institutions such as the World Bank and the European Union joined this effort once we had completed our impact assessment, and we worked together with the World Bank and we identified where these priorities, investment priorities, are located, but also financial investment plan that allows us to address those needs in the short run, but also to identify which are those investments that have to be carried out in the future. I know that the resources are limited, so we have to identify those actions so as to address those needs created during the crisis. But it's also important to us to be able to identify which are those actions that we have to carry out in order to reduce to the maximum possible extent the risks that we know we will have to face in the future. El Salvador is a country that is vulnerable to disasters of natural origin. We are vulnerable to health crises as well. And so it is significant not only to think how is it that we are going to address those crises and to recover after the crisis, but we also have to think of all the actions necessary in order to be strengthened and how to reduce those risks in the future. Thank you very much. Thank you, Maria Luisa. In this second section, I would like to ask Elizabeth if she can deepen on the topics related to the planning of a recovery post-disaster in the building of capabilities in our countries at a regional level, and how these instruments such as the framework for recovery or the fund can become efficient instruments to face some of the main challenges related to governance, to regulation frameworks, and to funding for recovery.
Thank you so much. Thank you very much. Thank you very much, Carolina. So thank you for the question. I would want to speak to maybe three things. So I think, first of all, absolutely critical is this whole issue of recovery being a whole of society approach. And when we talk about a whole of society approach, there need to be appropriate arrangements. We've done some studies in the Caribbean region, and one of the things that has emerged very clearly is that the leadership for recovery really needs to be nested within the ministries of finance and economic development planning. And the bringing together of the various aspects of the organizations and entities within the society, it must coalesce around that larger developmental goal, which is identified for the country. In addition, some of the things that we have found out from the studies that we have done have really pointed to the importance of community involvement in the recovery processes. So when we're discussing whole of government, there's a very important space that must be made for the people for whom the recovery is being planned and allowing them to be a part of that conversation as the recovery rolls out. The second comment I would make is really around capacity for recovery, because many times we discuss recovery, but we've not actually invested in ensuring that the entities that are working on recovery fully understand the recovery and all the nuances related to it, how recovery fits into the bigger picture of how we're trying to strengthen resilience and of the broader discussion around managing risk. So in the Caribbean, for example, we are moving towards now specifically developing opportunities for learning about recovery in collaboration with the University of the West Indies and also with the World Bank, and making some of those training opportunities available in collaboration with our regional training center. I spoke previously about the ex-ante recovery planning, so I won't dwell on that here. But the last thing I would say is related to the matter of resources. So recovery, as we know, is it's a time of opportunity. And to be able to harness that opportunity, we do have to have in place the appropriate resources to be able to support that recovery process, and the government's abilities to be able to secure access to resources as well as to mobilize resources to have adequate funding for recovery is absolutely critical. And I know this has been a challenging issue for small island states, particularly those that have graduated from ODA eligibility. And I think this is a part of the broader development financing discussion, but it is one that has to be had because resources are absolutely critical to move recovery processes forward.
Gracias, Elizabeth.
Thank you, Elizabeth. Cynthia, in your first intervention, you mentioned the importance or the key role of communities in the post-disaster recovery processes. Can you, in this second intervention, share with us how we can ensure that recovery is actually centered on people in their livelihoods and thus guarantee the sustainability of the recovery processes?
Thank you for the question. I want to start with response here. And during response, we're focused on life-sustaining and life-saving activities. And one of the constructs that we use for communicating our common operating picture across whole of society, whole of government, is what we call the community lifelines, which are part of our national response framework. And these are objective-based to prioritize actions and resources to stabilize communities in the wake of a response. And examples are things like energy, safety and security, communications. But these also apply to recovery and long-term recovery too. So we carry those forward as we transition between those two phases. And kind of similar to some of the things Elizabeth was talking about, we follow across the whole community working through recovery, the National Disaster Recovery Framework. And there's 5 big sections of that I just want to walk through quickly to articulate how this is prioritizing what the community's needs are, focused on outcomes and making sure that everybody's clear on the direction and how we're coordinating those efforts across multiple levels. So the first one is planning, where we're engaging the whole of community on strategic, operational, and even tactical planning to figure out what approaches and objectives we have as we work through the recovery phase. The second one is operational coordination. That's both creating as well as maintaining a unified and coordinated operating structure. The third one is housing. This is most often the most challenging, and it's critical for us to be considering things that are competent for the particular community, but also are sustainable and resilient, and we're able to communicate why the certain things are a priority and how we are working through this particular phase. The fourth is the economic recovery, which I know Maria talked a lot about. But this is the goal of this is to really have an economically viable community, and that will look different for different communities. It's not about returning to where you were before. It's not returning to a certain level, but trying to get to that economic viability. And then the last one is health and social services. So restoring healthcare if that infrastructure had been damaged during the disaster, and then also the sustainability of social services, which would be especially critical for our most vulnerable populations and making sure that we're not leaving anybody behind. We always want to shift the recovery timeframe to the left, but I think one of the important things we want to consider here is we have to be working with the community and working along together. And so in terms of making sure that we're bringing them along with us and they are along with us, we need to make sure that we're doing that together in a coordinated fashion. Thanks.
Gracias. Solo un problema.
Thank you. Technical issue. Perhaps if you can help us in keeping the time, because apparently it's frozen. Monica, you come from the world of, from the science world. You are connected to the University of Johns Hopkins, the Bloomberg Health Institute. So perhaps it's the right time and opportunity to discuss at length how science and technology can contribute to help building more resilient recovery, more inclusive recovery, and more sustainable recovery processes in the Americas and the Caribbean.
To ensure an effective and equitable recovery, we really need to change the image of science and technology. It's more than laboratories, manufacturing plants, and digital networks, which are all critically important. But they're the hard sciences, they're the hard infrastructure. And as the pandemic has shown, disaster and epidemic risk reduction systems need to rely more heavily on people experts, the soft sciences. And in the open plenary, Canada's Chief Science Officer, Mona Nemer, also pointed to the value to her country's response of including social and behavioral scientists. In the United States, we have experienced terrible shortcomings in the on-the-ground implementation of public health interventions. And these might have been avoidable, at least in part, with stronger, faster application of social and behavioral science, including community-based participatory research. Designers of the Science and Technology Initiative to develop and deliver COVID-19 vaccines, which was titled Operation Warp Speed, really approached the laboratory and logistics problems with fervor. And the country is grateful for that. At the same time, planners failed to consider what social scientists who work on vaccine uptake already knew, that a clinically successful vaccine also has to be socially acceptable and readily obtainable. So in that rush towards a science and technology fix that has and will continue to save lives, there was an underestimation of the need to foster public trust in the vaccines and the people who administer them, and also the need to remove those hurdles that the most vulnerable communities face in accessing healthcare, including vaccines. And also resistance to mask wearing, and also the uptake of other life-saving therapies, and the acceptance of unsafe, unproven therapies. These were all problems that community-based planning and behavioral and social science research could have mitigated to some extent. So that's response, that's the pandemic, and we're talking about recovery. But recovery from multiple and complex disasters can benefit greatly from known and novel insights into human behavior, cultural norms, social networks, and organizational dynamics, and from applying human-centered design principles. Some of the questions that arise and that that social and behavioral scientists can help with are ones such as the following. What distinguishes a recovery planning process in which diverse communities can genuinely collaborate with decision makers in creating, implementing, and evaluating the recovery programs? How does one understand community values, those that should be driving the allocation and informing the allocation of finite recovery resources? How do you discover those values? And once you know them, how do you communicate final priorities in a way that resonate with communities? And then a third question, and these are just examples, how can leaders track community views about the quality of an unfolding recovery process and then make course corrections so that affected communities can genuinely feel that they are benefiting from the goods and services intended for them? So I just want to underscore, science and technology also include the social and behavioral sciences. Thank you.
Bueno, estamos terminando casi.
Well, we are coming to an end, the first round of this panel, and before giving the floor to Dr. Daniel Salinas, Minister of Uruguay, Minister of Health of Uruguay, but in the context of this 8th regional platform and considering the ministerial meeting and the decisions that will be taken, I would very much appreciate that if you can, in 1 minute, select one recommendation that you would give to policymakers on how to incorporate post-disaster recovery in the agenda of disaster risk reduction, in the agenda of other countries, and make out of this recovery an opportunity to transform and have a more resilient society. Monica, the floor is yours. 1 minute.
I want to point out that social and behavioral scientists are important allies. They are attuned to social contexts. They use people-centered methods, and they hold in-depth knowledge of specific communities and human psychology. So, if they haven't already, nations should assess the extent to which their social and behavioral science research infrastructure articulates with the disaster risk management systems, and based on that evaluation, develop and implement a blueprint for more thoroughly integrating experts on the people problems into readiness, response, recovery, and resilience. So thank you. Thank you, Carolina.
Cintia, adelante, 1 minuto.
Cynthia, the floor is yours. 1 minute.
We need to focus on building capacity at the community level all the way up through the federal levels in terms of being able to successfully deliver on what the community see as the right outcome for their recovery.
Gracias. Elizabeth, desde el Caribe.
Elizabeth, from the Caribbean point of view.
I would say that recovery needs to be people-centered, evidence-based, and informed by lessons. And I think a critical part of this is really about how we are strengthening our damage assessment processes to capture some of the social dynamics which were mentioned, I believe, by Monica, and making sure that that's really incorporated into how recovery is being planned and executed.
María Luisa, desde El
Maria
Salvador.
Luisa, from Salvador.
Quizás primero reiterar
A huge challenge, but reiterate the key elements in response and recovery process stakeholders, an integrated approach, intersector work, leverage on technology, having the necessary resources, but as a way of recommendation, looking forward, and a very concrete and operational recommendation to tap into and be able to use the methods, the tools in order to identify the impact and concrete actions for recovery, like the PDNA and other tools that allowed countries to identify all things that must be done in advance before the crisis, to use what has already been proven, what is already shaped based on prior crises, but this is the practice that we are recommending. Thank you. A round of applause to all our panel members. This first block broken down in 3 sections. And now I would like Daniel Salinas, Minister of Health of the Republic of Uruguay, to share our host country experience on the integration and use of technology during the COVID-19 pandemic and the recovery process. Thank you. Good morning. First of all, it's an honor to be in this platform and to welcome you all to our country, to welcome you nearly at the closing of the event. Second, I feel intimidated vis-a-vis so many women in this panel, but it is important to underscore on recovering and building back better in an increasingly uncertain context, a vulnerable context, a changing world and threatening world. And this is what we are faced with. Besides COVID, there are wars, there are other epidemics, there are other plagues. Integrating and using technology during the pandemic in Uruguay was broken down in several items. And let me go through each of them. First of all, the pandemic management, which was based on 3 pillars: leadership, management, and innovation. We used an integrated or comprehensive multidisciplinary and interinstitutional approach. And we articulated at all levels of government, including the scientific community, research, academia, private sector, community, and we, the unions. We designed effective responses to emerging challenges. Talking about leadership, well, that implied an integrated approach under the leadership of the President and the Ministry of Health in synergy with all the ministries and the national emergency plan. We set a clear journey. The President, the Secretary Minister of Health, this is an example during the preliminary stage. Well, management. Management is a very relevant topic because it implies designing a health strategy, and strategies include policy, strategy, and tactics. And we designed a strategy that was that included the approach that would be understandable and to convey certainty to the population. We also established a solidarity fund, including the health, food, work-related aspects, equipment, resources, human and material resources, financial resources. The Ministry of Finance provided the funds to leverage on all these things, and that was key. This image worth millions of words. This is the team. Uruguay faced the COVID crisis by providing a systemic and comprehensive approach, working together at all the ministries level and department levels. Innovation. We carry out a health risk strategic assessment. We identify the areas requiring investment and capacity building. We developed technologies. We had the PCR test, LAMP or isothermic loop test, ELISA, and that ensured accessibility to diagnosis. We also develop facial mask, national respiratory systems. We followed the genomics sequencing, and it was a reference country for countries such as Paraguay and Bolivia. We passed the telemedicine law because it provided a real-time response and follow-up and monitoring of the epidemic. 28 test centers were created, 27 at level 2 biosecurity and a level 3. Lab 2 were mobile laboratories. And the coronavirus app is an example of how we introduced information and communications technology into the process to address the pandemic. So we could follow up people that had a positive diagnosis, and by being close to a smartphone for 2 meters and 15 minutes, that would trigger an alarm to all the relatives or people closer to that person. And this helped coordinate the process with the health providers. MIRA, Comprehensive Risk and Disease Monitor, was a key tool. It was real-time information of all the occupational situation, bed use, intensive care use, across all the health providers with positive georeferencing and vaccination monitor across the country. We will see this in the next slide. And we had different information layers.
The IDE is the development
infrastructure, spatial infrastructure.
Spatial development infrastructure. Here we have the Pasteur Institute, where the national coronavirus test was carried out with DNA broadening. Here we have the isothermic LAMP in the Pasteur Institute. This system was adopted for the test of the rapid diagnosis. This is for basic capabilities laboratories. This means a common laboratory, and in El Salvador this is being applied, and they came and they trained here in this country. This app allowed us to have access to general information, to have information on risk countries. If you had in contact with a person with the disease, it also allowed for the exposure alerts. This was not activated directly, but you had to accept so as to know whether you were in contact with a positive case. You could activate it or not. It was personal, but it was available. And on the third image, we had the exposure alert. But apart from these, it gave public access information on the new cases, the active cases, death and vaccination rates in real time, the exposure alert, the tracking and link with the doctors, the medical appointment, and it allowed for a daily self-diagnosis. There was also a vaccination certification with the QR code. the COVID-19 passport for the European Union, the history of the tests that were carried out, the medical discharge, the certification, and a medical certification, which was available in the website for all those persons that were certified so that they could have their online certification and they did not have to go to their place of work so as to present this. This is the symptoms report, the medical appointment online, and the transparent information, daily information, which gave visibility to the country and gave also tranquility and certainty to the population. This is a COVID passport on the left. On the right, this is the COVID testing with a QR code, the vaccination certificate, the platforms that were used, the dates, the QR code for the airports, COVID recovery certificate on the right as well, and which were the benefits when of telephone tracking through the ministry. Well, we had to have medical, technological tracking. So when a patient was positive, he received an SMS, and in his cell phone, it was no longer on a smartphone. That SMS allowed him to enter a page so as to have the contact data. So that data was added to the list, and there is way when we knew the cases and when we had 35,000 cases per day, this reduced the pressure on the health system, and we also respected confidentiality. This is a description of the technological tracking. This is related to what I have just said, how this worked. And finally, no, not finally, but what is the MIRI, Comprehensive Risk Monitor? Well, this is a geographic information system which is interinstitutional. This means that it comprehends all ministries with a national scope for decision making at real time. And this is planned by the Integral Risk Management, SINAE, and it has two main axes: the exchange of information and technological innovation and organizational innovation. So it creates quality statistics and warranties that the registries are unique with standard criteria and homogeneous criteria. This is very important for mathematicians and epidemiologists. As to the health ministry, the resources available and the cases of coronavirus as we're going to see now. What is this? Well, this was a job made by Rico and his collaborators, and it was a success, a case of success. This was available to the public at large and to the media. This was the situation in Uruguay. You can see the beds that were occupied and the ones that were available and the ones that were blocked, and the total occupation as well. Yesterday, we had 57% with only 3 COVID cases, and it's 0.7%. And this doubled in this opportunity. The maximum peak of occupation was of 560 and 55. After the big COVID waves, we have 903 beds, but we can expand ourselves. However, what is important is to see that graphic where we have the occupation level, and at no time was the system overwhelmed because we had a maximum occupation of 77% of beds occupied by COVID in spite of the great prevalence of the disease. As to infrastructure, the spatial data. This is a system that allows us to make consultations on geographical directions of the country, and this is used in all ministries. And this leads the articulation and strengthening of production and access to geographical information of Uruguay so that it is timely and interoperable, so that it operates well. So it gives support for decision making at national level, and it includes all bodies, public organizations, academia, and citizenship. So the coordination and cooperation are their main elements. This is a sample of some of the panels that allows us for the systematization of information, which allows us to see which are the hospital centers we have, which is the level of assistance, which are the first or second or third level, which have UCI, which have emergency rooms, which have ambulances, what is the equipment those ambulances have. So this allows us for a better coordination, and you will see certain distribution with a concentration in the capital city, and then we have Route 1, Route 2, 5, 7, 8, 9, and the coastal road. Well, this is not a coincidence. Once we put the filters, we can see the assistance centers. What this allowed us? Well, in disasters events, we can have evacuation to the nearest center possible. We will know which is the center that has a CT unit and emergency rooms, and which is the type of ambulance we're going to have, whether it's a regular ambulance or an advanced ambulance, apart from the recovery of the rescue programs in helicopters, of course. This is the information on the COVID cases by department, by municipality, and then you can zoom in and we could see the different phases where the sanitary resources were, where the eldest people live, and the hot areas during the epidemic. In terms of the sanitation policies, I'm not going to read this presentation, but the main aspects were information, prevention, diagnosis, treatment, and recovery and reintroduction to the labor work, and with permanent innovation always. So which are the main conclusions? We have to have we have to seek for solutions with a comprehensive approach. We have to have dialogue between institutions, technological and scientific developmental support, especially of the technology and communication tools, adequate financing. Here we have the Ministry of Economy. We also have to have feedback of the used systems, a system coverage in the whole national territory through telemedicine so that no one is left behind, assertive and timely communication, connectivity and coverage. Since we are entering a G5 tender, Uruguay has one cell phone per person, and it covers 93% of the population. I think 7% of this number, it's people under 5 years old. We also have a monitoring of vulnerable population, and an effective risk reduction requires for a sound framework of politics, legal, strategic, financial, and operative coordination. And for this, we need to focus on the technological and scientific support as the main tool for integral risk management. especially in what has to do with feasibility, development, funding, and application. And these learning curve we had with COVID-19 has to be integrated as a whole within the knowledge of the country for future experiences, and so as to have operative permanent proceedings, so as to face the challenges that can be in the future, new epidemics, floods, hurricanes, and we know that SINA is very well prepared for this. Thank you very much.
Gracias, ministro.
Thank you, Minister. I would like to thank you on behalf of our panelists to the Republic of Uruguay, which has made us feel like home. So as to end with this panel, I would like to pay tribute to Mario Benedetti, the Uruguayan poet, who said the following: uncertainty is like a flower which we will never end delivering. I hope this session has helped to take the leaf out of that flower, which is post-disaster recovery, and so that it is an opportunity to transform our societies, to make them more inclusive and more resilient. Thank you very much to all of you and those who have connected to this session. Good morning.
Así, de esta manera damos por finalizada la sesión.
So now we will end this plenary session, Recover and Build Back Better, in a context of increased uncertainty and complexity of risk, experiences, and lessons learned. We would like to thank Carolina for the moderation and the panelists for their contributions. There were memories brought about by those images, and I would like to remind you that you will have in your emails now a survey that we would like you to answer to assess the 3 days of this platform here in Punta del Este. We're going on to a short break, and we are going to be back at 11:30, and we will have some activities, the presentations from the Ignite stage, the parallel sessions on fire risk management, and learning laboratory on resilient solutions. We would like to remind you that we still have the vaccination center of COVID-19. If you would like to, you can have the vaccine applied here in the 8th platform. And 50 participants of the Women's Network keep on working on the observatory of PR23, assessing where this gender perspective is. Thank you.